Administering medications can be very difficult in the home and very stressful, not only for the dog, but also the pet parent. So there's things that we can do at home to make it a pleasurable experience and make it happy so that the dog gets excited about getting his medication and it's a lot less stressful. Hi, I'm Sandy Howle. Welcome to Con Classroom. So there's many different types of treats on the market that are actually designed to put pills inside of them. But a lot of times what we do, and we don't realize we do it, is we actually get the scent of the pill on the actual treat itself. So dogs can smell that when they go to eat that treat, and it makes them not want it, so they'll spit it out. So when we do this, when we make sure we're putting that pill or that gel cap inside of that treat, what you want to do is take the treat in one hand, the gel cap or the pill in another hand, and then we will actually put that inside of the treat, but you don't want the hand that touches the pill to touch the treat. And then we can close it up with the hand that's holding the treat. So what's happening is we are not getting that scent on the treat. So a lot of times it makes it easier and the dog will actually want to take it. Find a treat that your dog really, really likes to eat, that he gets excited about. I personally like to use hot dogs. And the reason is because we can actually easily put a pill or a gel cap inside of that hot dog. So what we can do is cut up about 6 to 8 pieces of that hot dog, put that pill inside one of them, and then we're going to quickly give a couple of pieces that don't have the pill. We want to do this pretty fast so that the dog gets excited about that treat. And then we give the piece of hot dog that has that pill in it, and then immediately quickly give those other pieces. So we're kind of distracting him with the yumminess of the hot dog or that treat that you decide to use. And then we can take and slip that pill in there in the middle of it, and he'll never know. So there's many different types of topical medications that we can use, from ointments to creams to drops, lots of different options there. So to start, we want to have a frozen Kong ready to go, something with food in it that your dog really likes to eat and that he will focus on and not get distracted. So it's got to be something high value. Then what we can do, if you have a second person with you, we can use them for help. So it typically takes about 20 minutes for a topical medication to actually soak into that skin, depending on the medication, up to 20 minutes. Now, if you have the spot that you're treating is actually in a place where maybe the dog's laying down and it's going to be in the way, maybe on his belly or his leg, we can go for a 20-minute walk. That way, if it's on the belly, the dog's not laying on it, it's not getting in the carpet or whatever. Go for a 20-minute walk, and then we're coming back and we're rewarding with that frozen Kong. So if you're a dog owner, there's probably a high probability that you're going to have to administer some type of ear or eye drop for whatever reason. So there's things actually we can do now to kind of prepare for that. It's not an emergency situation. It's something that we can do short training sessions with in our home. Again, creating that positive association. We want the dog to understand that it's not a bad thing getting that medication. So what we can do is desensitize. So when we desensitize our dogs, it's just short training sessions, just getting them used to that. Get some super yummy treats, have sit on the couch, have them in a Ziploc bag, a treat pouch, whichever works for you. Have an eye drop or ear drop bottle, just set it on your coffee table. If your dog comes over and he looks at the bottle, give him a treat. If he gets a little bit closer to it, give him another treat. If he gets closer, give him 2 treats. And then we just continue doing that until we can actually get that bottle, work it a little bit closer to his ears, a little bit closer to his eyes. And that way he's getting used to that feel, that bottle being next to him. And again, we're creating that association, but rewarding at the same time. So it's super exciting for him. We never want to put the dog in an uncomfortable situation. So in that situation, if you feel like he's getting uncomfortable, maybe he starts to back away a little bit, take a step back, go back to where he was comfortable, and then kind of go from there and start again. It may be a situation where he's done, he's not having it, he's a little uncomfortable. Maybe we end, but we always want to end on a positive note. So again, take a few steps back, start again, and then kind of go from there. I'm Sandy Howle. Thanks for joining us in Con Classroom.